Well, hello, everyone. Here I am. It's me, Rashi, with another edition of Parent to Parent. I'm so excited about this one. I actually just talked about it. I don't know if you watched the 5 p.m. broadcast, but we re-aired the story that aired first yesterday at 9 o'clock, talking about Botox and just the cosmetic benefits. Full disclosure, my mom actually got me into Botox because she said, Rashi, it's preventative. And so you don't really see that many wrinkles. I go to the Institute of Anti-Aging Medicine, and I've gone to several other places. But the point is going to a reputable place if you're going to get it done for cosmetic reasons. And one of the big things is I know so many people get it done, not just moms, but dads too, or you don't have to be a parent, you get it done, male, female. It's just becoming so popular. And one thing that I do want to make note, because I know that in the news, and also I've talked to the Houston Police Department about this as well. There's so many scams out there in spas that say that they do Botox and other treatments like fillers and stuff. But the average amount that you want to pay is between $10 to $15 a unit. And for each person, it's different on how much you want to get done. And so if you see someone that's charging you less than that, that might be a red flag, because sometimes they dilute the solution or they're getting it illegally somewhere. So whatever you put in your face, in your body, you want to make sure you get the right stuff. So I definitely encourage you to watch the story. And also, if you want to go out and try to do some research yourself, just remember that $10 to $15 range is where you want to be at. Well, it's not just, your face that you want to use preventative measures for Botox, but also there's medicinal benefits. And you probably heard the biggest one being migraines. I know we've had that on the news. It's a lot of headlines. Sorry about the noise in the background. It's live and we're in a working newsroom. But I want to bring about two people, actually three that I have here. There was a problem with, I don't even know how to say it, but I'm going to put it right here. I'm going to get a doctor to say what this is. It's RCPD. And here is Dr. Andrew Tritter, who is an ENT specialist here in Houston. So thank you so much. Good evening to you. Thanks for joining us.
Thanks so much for having me. Appreciate it.
So how do you say this word?
It's called retrograde cricopharyngeal dysfunction.
And what exactly is it?
So this is essentially a relatively new condition. It's only been about for the last few years, and it's actually an interesting case where this is patients leading the front of medicine. A physician by the name of Dr. Robert Bastian out of Chicago was the first person to find a couple patients who just complained of a lot of the same symptoms. Essentially, they'd have these discomforts in their neck, in their chest. They'd have these gurgling noises that would be socially awkward to other people around them, a lot of bloating, excessive gas. And the one common thing between all of them is that they all had the inability to burp for pretty much their entire life. And he, with a few patients, tried out a treatment where he Botoxed this cricopharyngeus muscle, which is essentially just the gate at the top of our esophagus, and found that with this Botox injection, not only were they able to burp for the first time in their lives, but a lot of these really bothersome and very significantly improved and relieved. And also interesting, as I'm sure a lot of your have noticed from talking about Botox before, Botox only lasts about 3 months. But interestingly, in this case, patients only need one injection, and they have significant long-lasting benefit, at least 80-90% of the time with the first injection.
Do you think it's because it doesn't dissolve as fast, or what's the reasoning behind that?
So well, first of all, we're still learning a lot about this. It's a pretty new condition. At least my running theory and some of the other physicians who treat this actively, we kind of see this as the body never developed that reflex that most of us have to just allow the air to escape naturally on its own. And it's kind of like you're giving the body a set of training wheels to know what it feels like to let that muscle loosen up, let the air come out. And then as the Botox wears off, kind of gives you a chance to figure out those pieces of the puzzle on your own.
Yeah, definitely. I know that you've been like such a savior for Allison and Morgan, adding them to the stream here. So first off, Allison, I know that you were really concerned because Morgan, your daughter, who you see on the left side of your screen there, I'm going to first ask you, Morgan, like, what is it like? What happened? How did this all start?
So about last year, I started having bad nausea and the gurgling sounds that Dr. Tritter mentioned. And it was something different. I hadn't experienced it like that before. And so I went to a GI doctor because I thought it had something to do with my stomach. So he put me through a bunch of tests, put me on a medicine, but nothing seemed to really help. And so, of course, my mom got on to the internet and started looking up, like, what is this? What's causing it? And she found Dr. Bastian, and then that led to Dr. Tritter.
And I mean, how uncomfortable is that? Because you don't really realize, how much you're kind of burping all day long. And I'm sure that's got to be very uncomfortable.
It is really uncomfortable. It's hard to explain to people too, because they just don't get it. Like, nobody really understands it, because it's just like a natural thing for so many people, but it is really uncomfortable.
Is it very painful?
I would say, yeah, it's painful. And then after like the gurgling resides, you're still left with nausea it could be up to hours that you're still left with nausea from the gurgling.
Wow. Yeah, because one of the things is that this is, self-diagnosable too. So like, there might be people that feel all those symptoms, but they don't know what's going on. And I know, Allison, you were very active in trying to figure out a solution. So tell me kind of your process of trying to find a solution.
Yeah. So, she had just left for college and she started complaining about the gurgling and the nausea. And of course I thought, it has to be, GI problems. And so, like she said, we took her to our doctor, mine and my husband's doctor, and we did every test under the sun, stomach emptying, endoscopy, everything. And then we were in Florida on vacation, and she just happened to mention, I don't know how to burp. I can't burp. And I'm just going, what? How could that be? And then so it immediately clicked that this has to be the reason she's having all these problems. And so when we got back from vacation, I got on the internet and I spent months researching it. And surprisingly, there were a lot of people on there. I would say, 1,000 at the time, but now there's thousands. And, so I started seeing that everybody had, a lot of people had this condition, and there were a handful of doctors in the country that were doing it, some people in Europe. And I sent some emails to a couple of those doctors. I didn't get responses. And then one day I was, on there reading all the posts, and all of the symptoms matched exactly what Morgan had been going through. And all of a sudden I see Dr. Tritter post that he had just recently moved to Houston and that he treated patients for RCPD. And he said, just call my office and set up an appointment. And Dr. Tritter was real active on the website for a while after that. I was really impressed because, he was taking his time to just answer all these Q&As, people, asking questions. And so we set up an appointment, got in pretty quick and went to see him. And she was treated 3 weeks ago, but it was really frustrating. It was a long process. And, I just can't tell you how frustrating it is. Your child is sick. You can't do anything. You can't find medication to help them. We tried everything to ease the symptoms and nothing worked.
And your sister is like, Dana, who we've heard from before, she deals with Botox all the time cosmetically. Mm-hmm. So I'm sure she was, when I talked to her also, she was just so surprised that this is what is helping her.
Mm-hmm.
Yeah, definitely. So what did that feel like? So what was the process? And I guess I could bring in so we're all connected now at this point. So Dr. Tritter, what did you do medically to her? Because I understand it's not like obviously a topical injection that you give.
Correct. And there is one way to do it in the office like that too. So there are two ways that you can inject this one particular muscle with Botox. The traditional way is in the operating room. It's a very fast and straightforward procedure. It takes about 5 minutes to do, but we do it under general anesthesia, more for patient comfort. It also allows us to look through the throat directly at this muscle at the top of the esophagus and see it more clearly so we can inject a higher dose of Botox. And the doses we're talking about are substantially higher than what you would inject for normal muscles in the face. So whereas you might get 1 unit here by your eye, 2, 5, something like that in certain parts of your forehead, we usually inject about 80 units into the cricopharyngeus muscle. So a substantial amount, and there are some people kind of trying to figure out still what is the right dose. We still don't exactly know. But that's the traditional way. We can do it in the office with the help of a machine called an EMG, which is essentially just a machine that has an electrode on the needle, and it kind of goes off and makes noise when you are in a muscle. And by having you swallow while the needle's in place, we can tell that we're in the right muscle and inject it there. It does have a little higher risk of some side effects, mostly in the form of some hoarseness with your voice, because you do have to go next to the voice box to do it, but it can be done in the office as well.
So what did that feel like, Morgan, after you got off of the general anesthesia?
Honestly, it wasn't like a hard recovery at all. I just had a sore throat for a day and then some slow swallowing for a week or two. And then it was
You're
all
good. Carbonated drinks and all.
Yeah.
That's awesome. Can you imagine 80 units on your face? You'd have like a frozen face. You look like maybe a celebrity or two. We know.
Well, I'd say for that reason, it's important to note. So we don't do this routine. Now, we don't do this routinely on people who are maybe older, have weaker throats or weaker swallowing mechanism. It's a really common condition that we see in younger people, and I feel a lot more comfortable treating younger people because they're able to bounce back from such a high dose of paralysis from the Botox, because that's what it's doing. It's paralyzing that muscle. But in general, yes, it's a substantially higher dose.
And Dr. Truda, can you talk about just some of the other reasons that people would get Botox for medicinal purposes?
Well, just kind of bouncing off this one in particular, this procedure actually has been around for a very long time. We usually use it, though, to treat what's called just regular cricopharyngeal dysfunction, people who have trouble swallowing because that muscle won't open up and let food go down into the esophagus. So we relax it so that people can then let food pass normally as you would any other way. So that's a common, at least, correlate there. But for me in my practice, I'm what's called a laryngologist. So I work a lot with patients who have voice, airway, and swallowing issues. But the voice aspect in particular, we frequently use Botox to treat certain types of spasm-like conditions of the vocal cords. There's a condition called spasmodic dysphonia that makes it very difficult for people to get their sound out on a regular basis. That's treated routinely with Botox and can usually get pretty dramatic results in the quality of someone's voice. We use it routinely for things like people who have excessive saliva or secretions, maybe say after a stroke or other neurological conditions. We can use the Botox to actually not target a muscle, but to target the salivary glands and decrease the amount of spit that they're producing so that they're not drooling over themselves or things like that. Wow. And then, of course, there's not just the regular cosmetic muscles in the face approach, but certain people have really bad conditions that cause things like dystonia, which is an excessive contraction or abnormal contraction of a muscle that can happen on the face and the neck. They become very tight, very uncomfortable, and very painful. So oftentimes we'll inject those as well to give a little bit of relief.
What kind of warnings would you give people that are looking to, looking into basically Botox to try to solve some of their issues?
I think it really just depends on your condition in the first place. For the people who treat these types of, say, neurological conditions on a regular basis, they'll usually put you towards the right people from the get-go. It's not like the cosmetic approach where you have to do a little bit more of the shopping yourself. Obviously, people go out and search for second opinions and things along those lines. But generally in this realm, when you're getting it for more medical rather than cosmetic purposes, most people are going to be, thinking in the right place for you.
All right. So I know, Allison, you were really, really excited to tell people about this and you wanted to. I know that you were part of a community. So I know that you've tried to reach out to several people that this is a solution. What has the response been so far?
I guess it's the same. What I'm hearing from people and all the stories that I read prior to Morgan being treated were, people were saying it was a life changer. And most of them said it was one and done, one shot and done. And they were able to learn how to burp. And it completely changed their lives. We're talking about people that have been suffering from this for 40 years and, 20 years. And in a lot of cases, it starts to really show itself when somebody's in their 20s or 30s. And so Morgan was, shy of 19 when she started experiencing it. And, all we kept hearing was, oh, Morgan, you have anxiety. It's all in your head. It's you. It's not, there's nothing going on with you. But so it, same thing for everybody. Everybody tells the same exact story. So when you called, I was really excited to do this, as was Morgan, so that we can share this information and get it out there, because there are so many people suffering from it, and they don't know where to turn.
Yeah, definitely. And I wanted to ask you, Dr. Tritter, also older people who may have a condition like, say, Parkinson's or something, and they're dealing with saliva or, with voice or any other condition. And one of the effects is something to do with the larynx or that area. Would you recommend them looking into something like this?
Not necessarily to the Botox situation. So
Okay.
with Parkinson's, people tend to be a little weaker.
Mhm.
And that's kind of the last thing you want to do, is really weaken
Right.
them. Now, the excessive secretions and saliva, that can certainly be something that's warranted. But for most of the muscle type conditions that you're treating, not as useful for them in particular. There are a lot of other things, injection related, that we can do for some of those patients, at least in my realm, dealing with voice, swallowing, and that sort of thing. Oftentimes people's vocal cords need a little bit of augmentation to be a little plumped up so they can be louder with Parkinson's, for example. So again, treating something with an injection, in our realm.
Okay. And last question I was going to ask you is, what are the symptoms? Because I know that this is something that people can diagnose themselves, and they might, it can be embarrassing. Like, I can't really burp, and it's like, well, am I just weird? Is there a GI problem? So what are some of the symptoms that people need to look out for?
Well, in general, there are 4 things that people usually look out for. The first of which is a inability to belch that has almost always been there for as long as people can remember. People oftentimes generally complain of a lot of pain or discomfort, particularly after meals or after maybe something carbonated if they drank that, usually in the throat, in the chest a little bit. People oftentimes have a lot of excessive these gurgling noises that I know Morgan mentioned earlier, that you can audibly hear if you're standing next to somebody who's having them. And then there's a lot of bloating and gas that goes along with that too. So if you have those symptoms in general, there's really not a test necessarily that you can take to say that you have it. The likelihood that you do is just quite high.
Mm-hmm.
The test actually really is the Botox injection, which just happens to be therapeutic at the same time. So not only do we figure out that, okay, this fixed your problem, but it also treats you at the same time.
Awesome. Well, thank you all so much. Yes, go ahead.
Yeah, I just wanted to add one thing. Obviously, Botox is not covered by insurance when you're putting it into your face, but in this case, it was covered by our insurance, and so that's very beneficial.
Yes.
It's still a new. Essentially, I think 2017 is when Dr. Bastian started doing this treatment, so it has been approved for this use with many insurance companies, apparently.
Oh, that's great. That's good. And do you know, I guess that would be something that you'd go through your insurance for, to do it that way. Okay. And now, Morgan, you can have carbonated drinks.
I can, yes.
That's awesome. Well, thank you, Morgan, Allison, and Dr. Tritter for joining us and spreading the message. And I do hope that you just continue, Morgan, to keep doing what you're doing.
Thank you.
All right, great. Thank you all. And I appreciate everyone here joining us from our Facebook page, our website, and also our YouTube. Next week, we'll have another edition of Parent to Parent. So until then, I'll see y'all.